There's been a lot said recently about the drug Ivermectin to treat COVID-19. The country's Medicines Authority today announcing that it will be sharing an update on the Ivermectin issue. And of course, that update has reached us. Joining us for this conversation is Professor Vishwas Sakta, who is the board chairperson for the Cooperative and Policy Alternative Center. Professor Vishwas, good evening and thank you so much for your time. Now, when it comes to Ivermectin, over the last couple of months between December and January, it's really gained a bit of traction when it comes to news about its efficacy in treating COVID-19, even though that's still quite contested. But SAHPRA today seems to be giving in somewhat.
Yes, it's a signal, an important step in the right direction. But I think we just got to give some context to what's been happening around the public discourse. As you know, we hit our second wave, and we've seen cumulative spike, if you like, in infections and even in death. And I think a real ground level picture in that context was buckling healthcare systems. Doctors and healthcare workers literally floundering and kind of desperate to try to kind of work out how to keep people alive. They've been at the cold face of death, if you like. Now, of course, Ivermectin has a long history, which I'm not going to go into. But just to say, in terms of attempting to bring it into frontline treatment for COVID-19, there was an Australian study done sort of a few months at the beginning of last year. And that began to show some very, very positive signs in terms of Ivermectin's role in treating COVID-19. But again, that study said that randomized clinical trials were necessary. Since then, the US frontline coalition of doctors have also been trying to think about a treatment protocol at the front line to help doctors, to help healthcare workers. And they've been looking at a whole set of possible drugs that could be repurposed. And in their work and in their observational studies, etc., Ivermectin was also beginning to show some positive results. So in that context, you've also had some countries beginning to stream what called randomized trials. And these have mainly been countries in the global south, countries like Bangladesh, Mexico, Brazil, etc. Now, all of these studies have thrown up, again, some very, very important indicators that Ivermectin has some impacts on viral load. Ivermectin helps patients recover quickly depending on the phase of infection and so on. And of course, it helps relieve the pressure on hospitals. The big issue here is the gold standard of science. And the gold standard of science is to have large enough randomized trials, very credible data, controlling for bias, etc. And ultimately, the World Health Organization, if you like, assesses at that level and makes a final determination. Now, we are in that process right now. There's a Dr. Hill working on a meta-analysis of all of these studies, and his preliminary results is affirming a positive role for Ivermectin. So it's in that context that many frontline doctors have been calling for the use of Ivermectin. It's in that context social justice activists have put a petition online, and they have almost 50,000 signatures. And it's in that context some of us also called for the president and the healthcare authorities to take note of Ivermectin, and for us to really think in a context of an exception, if you like, pandemic, lives being lost. So we have a standard of science. We don't have the gold standard, and many of us do want that gold standard. And we do agree that SAHPRA must maintain that gold standard approach. And yes, it must make decisions in the interest of our country and public health. But here you have an exceptional situation. And so it is really heartening that SAPRA has listened to all of these voices and that has made the decision it has made today, that on compassionate grounds and based on some of the limited science, and it is saying that, you know what, more verification has to happen. Ultimately, the gold standard of verification from the World Health Organization still has to happen. But it has made this decision. And this decision is very, very important because on the one hand, it balances the rights of patients in our country who are aware that ivermectin can be used in treatment and they might want to ask their doctors for that treatment.
Sure.
The second issue is doctors themselves compelled by the Hippocratic Oath to serve their patients, and they're really trying their best at the front line. And this decision by SAPRA also then gives, if you like, responsibility now to our doctors to administer ivermectin. Of course, there's going to be protocols. The devil's always in the detail. Let's hope SAPRA doesn't bureaucratize this process. But in the main, it's the first step based on existing science, based on the crisis we are in, the loss of life, to bring this drug into play, if you like.
Professor Satka,
personally,
we're going to have to leave it there for this afternoon. Unfortunately, we've run out of time for this interview, and he is with the Cooperative and Policy Alternative